that's fine.
Okay. Assalamu alaikum. Welcome to this special event hosted by Maldivian Thalassaemia Society in order to commemorate International Thalassaemia Day. Maldivian Thalassaemia Society ge faratung alon men Korea megenda live event Thalassaemia International Thalassaemia duaha goluwage megeneste live event marhaba. And International Thalassaemia Day greetings to all our patients, parents, well-wishers, and healthcare workers who around the globe who is tirelessly working on this. Vainalagwami thalassaemia duwahuge heoye duntan alugon menge huriha kudinna veleni verinna mihuna adi alon menge alugon mena ko masekke kura huriha befulonna doctor na naruhunna sihi khidmat terinna miyaduge tahuniya ya heoye duntan ariskura engelabane thalassaemia duwahaki alon men namaste ganwadiya hatarwana harun peshigen wara kulagada kon fahaga kuramun anna duwahe wara gura masekketake kurave duwahe enames miyaharu alon menna mi dimavi gotun tankole tafatu kon mi duwas fahaga kuram me jehuni enge waragina gonje hun taken ebahori waragina mi hinu tanavas hun takes ebahori kan enames alon men ekuga masekke mi korani thalassaemia aila taka dolaheo duwas takakan edemo. International Thalassaemia Day is dedicated to raising awareness among policymakers that is very important and among general public and also focused on highlighting the needs of our patients in order to ensure that they have an equal chance in life like everyone else. While we also continue to commemorate our dear friends who have fought a brave battle but are no longer with us today. Their memories linger with us and stay with us every single day. Alun me thalassaemia dos fahaga kuramundar wara muhimmu kamedde kame mi kamuga thalassaemia kudinge dulaheo kama masekke kurun ekudinna dulaheo mustaqbalan edem. Midwasariki alun lafa kore hama thalassaemia kudinne ke gotan hama amunna bes wara babar gonje huntake wara babaru ihusastake kurave duwastake adi le alan diu misalka le ala kudinna e le alan diuma le donarum hoduma mikanka muge sar babar gonje huntaken e bahuri ema las nuko alon benun alon menge panel tibe fronna hame geneste we have an expert panel with us today and we are very honored to have them here. And on behalf of all our thalassaemia community, we would like to thank for taking time and being with us here today. So let me introduce one by one in our panel. Dr. Michael Angastiniotis, he is the medical advisor at Thalassaemia International Federation. He is also a very good friend to us and the Maldivian thalassaemia community. He knows a lot about thalassaemia situation in the country here. And Dr. Michael has been a member of the Thalassaemia Control Program in Cyprus from 1971. He is a member of WHO Ad Hoc Advisory Committee in Control of Hemoglobinopathies Disorders since 1980s and has served on WHO Expert Advisory Panel on Human Genetics as well. He served as a consultant to WHO in the Middle Eastern area, West Mediterranean area, and director of pediatric department in Makarios Hospital in Cyprus, in Famagusta, and also in the UK. He has published several scientific research articles, mostly focusing on thalassaemia and hemoglobinopathies, and he is an invaluable asset to our thalassaemia community. Welcome, Dr. Michael.
Thank you. I hope you can hear me well.
Yes, we do hear you. Next, we have Dr. Hamid Faisal. He is the consultant pediatrician in IGMH, that is the public hospital in the public tertiary hospital in the Maldives, and he is well versed with thalassemia treatment and management. And Dr. Faisal is the recipient of the Thalassaemia International Federation Renzo Gallinello Fellowship and had his training on thalassemia and sickle cell disease in UCL, UK. He has been helping Thalassaemia Society, our patients community over the years, and he has conducted several several awareness sessions and volunteered with us for over the many years. So Dr. Faisal, welcome to our panel.
Yes. Oh.
Dr. Ahmad Umar, he is the Associate Specialist in Pediatrics at Maldivian Blood Services since 2015. He's also a member of the National Blood Council since 2016. And he is also well versed with thalassemia. His first exposure to thalassemia was in She Laboratory when he started work in 2003 as a laboratory assistant, where I was his supervisor. Welcome, Dr. Umar.
Thank you.
Then we have Ms. Aisha Shifni Shakir. She is an executive committee member of Thalassaemia Society, an active patient advocate, and is a member of Thalassaemia International Federation's active sickle cell disease group and thalassemia patient advocacy group. And she worked as a teacher by profession, beta thalassemia sickle patient, and a mother of 2 lovely children. Welcome, Shifu.
Thank you.
And I am Jihan. I'm the chairperson of Maldivian Thalassaemia Society, and I have been volunteering in this field for over 28 years now. By profession, I am a public health specialist and a medical laboratory technologist with a specialization in molecular genetics and expertise in diagnosis of thalassemia and other hemoglobinopathies. I also served as a member of the Thalassaemia Advisory Committee to Minister of Health and have conducted several scientific research work in the field. So I can say that I have also dedicated a lifetime in this field. And I will be moderating the session for the hour. So let's start with the focus of today. So we are focusing on COVID-19 and its impact on thalassemia. So alun menge panel ga mitibbevi Dr. Michael laki TIF ge medical advisor adi alun menge waragga rahumeteri ves me daira ga wara furna us befle. Dr. Faisal laki consultant pediatrician IGMH ge alun men thalassemia ge ane faruaya mikan kamun tamrin libila wagen e masake kurabamun alon mena eku masake kuraba befle. Dr. Ahmad Umar ki Thalassaemia Center and what Maldives Blood Services ke thalassemia patient balahattava doctor associate specialist in pediatrics hamalon menge garatise Aisha Shifni's Shakir executive committee member and the patient advocate aluwan den Thalassaemia Society ge chairperson. The miedu ke alun me balalani thalassemia bali no thalassemia ya mihar alun menge mi health emergency kama wa COVID nawaraya puri guluma ekam libe patient mikan kamu rakka teribuma kureveni kanka ema furatama alun ane flow hulwala ni Dr. Michael la. So I would like to open the floor to Dr. Michael. If you can give us a small overview of the impacts of COVID-19 and thalassemia, that would be really appreciated. Dr. Michael.
Okay, thank you very much. When the thalassemia epidemic became known and was given publicity, the Thalassaemia International Federation immediately became worried, feeling that the thalassemia patients, especially those with most comorbidities, most complications in the heart, in the liver, in the endocrine glands, would be at high risk. And of course, we were especially worried about sickle cell patients because sickle cell patients are more prone to respiratory acute chest syndromes, which can be triggered by viruses. So we immediately tried to develop a protocol, guidelines, some kind of patient pathway, especially where the treatment centers were concerned. Unlike the general public, thalassemia patients are obliged or forced by their own condition to be frequent visitors to thalassemia treating centers for their blood transfusion, for their blood tests, etc. So we had to ensure safety both of the patient and of the staff and of the other patients as they enter the thalassemia center and the blood transfusion centers. In this way, we developed a patient pathway. Now, I can't go over all the details of the patient pathway, which we developed, but if you look at the TIF website, you'll find it all there. Basically, what we expected is that each patient arriving for blood transfusion should be triaged. In other words, there should be at the entrance of the thalassemia hospital some kind of area where a nurse or a doctor will ask questions, look for fever in the incoming patient, and if if a COVID infection is suspected, then that patient goes first into an isolation area and gets tested for the coronavirus. If everything is all clear, then the patient can go to the transfusion area. At the same time, an appointment system was set up so that not too many patients are transfused in the same area, so that we can space out blood transfusions and thereby satisfy the need for social distancing. Again, we advised our patients to practice in their own homes and in their private lives and in their employment, social distancing, and all the measures that are recommended. In the Maldives, where the patients are known and registered, we have good records, and yet we have few patients actually been infected. At the same time, we have good results in patients who are infected. In other words, they seem to do quite well in the majority. So we are a little bit puzzled at the moment. We're trying to look for explanations. As I said, the most obvious issue is that there might be underreporting of cases, or cases are being undiagnosed. But the fact remains that we did expect a worse picture. So maybe thalassemia patients are, in fact, somehow protected. Maybe because they entered, they stayed at home, were more strict in their protective measures because of their own condition, and therefore really managed to protect themselves. So the COVID infection has affected thalassemia less than we expected in the beginning. To a certain extent, the same goes for sickle cell disease, although sickle cell disease, as I said, is more prone to respiratory problems, and therefore we are seeing a higher mortality rate of about 10% in the global community of suffering from sickle cell disease. Another issue that has emerged from thalassemia patients, and this is global, is blood shortages. The effect of lockdown, which was adopted in most of the countries, and fear of the coronavirus has prevented the blood donation program to be to stay as it was before the virus. In some cases, in some countries, and I don't know about the Maldives, I hope to hear from you, blood donation has reached such low levels that even hemoglobins of 5 and 6 are allowed in thalassemia patients. And this is, of course, to me, a disaster. This has not happened everywhere, and where blood services are well organized, this has been avoided. But again, even in 1 or 2 European countries, this has been a problem. And it most certainly has been a problem in most of the Asian countries. So addressing the issue of blood donation has been a major concern. And again, the Thalassemia International Federation has tried to promote this by making awareness, by helping people to facilitate blood donation as much as possible. Another interruption, perhaps, is the program for adopting the new therapies that have been licensed. As you know, luspatercept, which is meant to lengthen the interval between transfusions, has been licensed in the United States, not yet licensed in Europe. And gene therapy has been licensed in Europe and not in the United States yet. But these novel therapies are a concern. COVID has actually interrupted their development, interrupted their outreach to patients. But even worse, apart from the COVID pandemic, our concern is of accessibility and affordability for every patient in an equal manner across the world. And this does not seem to be able to happen for a long time yet. So I will stop here and listen to what the Maldivians themselves have to say and answer questions if you need me. Okay.
Yes. Thank you, Doctor. It was very thorough, and it was very happy. We are very happy to hear the developments, and also wondering why the infection rate in thalassemia for COVID-19 is it because of the prevention measures that we have been taking, or is it because of the some other unknown factor? So I'll give the floor to Dr. Faisal to say something.
Yeah. Okay, we also, I think, if we see a population of COVID-19, we have a few kids already positive with COVID-19, and so far we had 19 kids actually, and alhamdulillah, and so far nobody from the thalassemia population is there. So our kids are quite okay. Most of them are doing very fine. Most of them actually asymptomatic now at the moment, and they're quite stable. And I was able to join the previous Zoom webinar from you, the TIF. I think Shifni sent me that link, and I was able to go through it from the TIF actually. As you said, there are the thalassemia population. Probably many of them are protected. I mean, they take a lot of measures, and there were some theories regarding the COVID, whether it can protect from the sickle, the HP, the abnormal HP could protect some. But alhamdulillah, so far I think that we are doing okay. I think we have been managing the blood as well, right, Dr. Omar?
Yes.
Yeah, Dr. Omar, anything to add before I just summarize what Dr. Michael has said in Divahi? I will, yeah, after you.
Okay, so as Dr. Faisal mentioned, we have not yet got any report of any of our patients being tested positive for COVID-19 in Maldives. So far, if I'm not mistaken, we have had 3 patients undergo the investigation for COVID, and all 3 patients got negative result. And we have, I'll just add some point to Dr. Michael's talk regarding the situation in Maldives. Um, we have adopted the guidelines provided by TIF, the pathways which Dr. Michael has said. We are following those guidelines, and we have also established our own pathway to manage the thalassemia patients' treatment during this COVID pandemic. And we have in Male at the Thalassemia Center, we have triage at the entrance, so that each and every person who enters the center is triaged before they are allowed in the center. And if a visitor has any features or any suspicion of COVID-19, we are not allowing them in the center in order to ensure the safety of our patients. Even for donors also, we are doing triage, and we try to, and we have adopted the appointment system for patient consultation, transfusion, and even for donors blood donation, in order to minimize the crowding in the center and keep the social distancing, practice the social distancing. And regarding the blood donation, initially at the beginning of the crisis, we had a decreased number of donation, and we try to highlight it at a national level through the National Emergency Control Center with the Operation Center. So we were able to advocate the public on the importance of blood donation in this situation, and I'm really happy to say today that we have a quite good response from our public for blood donation to our thalassemia patients, and we are currently experiencing the highest number of voluntary blood donation in the past, in the recent past. So, and we are able to keep the balance, blood balance at a good level for the past 2 weeks. So in that end, we are doing better than before, I should say.
Excellent.
Thank you, Dr. Umar. Dr. Michael Kurin Fahage Kolli Thalassaemia International Federation ge Faratum was Thalassaemia community ya Thalassaemia eki jamia takan ehi teriwamon midani emihunge guideline tan hadamun thalassaemia kudin na mihun mikamun rakka teriwamattaka pathways tan edun le alan dairo gaya le negumo gaya de kudina farwa dinumuga eki kankam bahat battan kurambi goen angamon midani ehma ibeflunge mi guideline taka eggota MBS umas tanta kurabba kama Dr. Umar Vidali adi Dr. Faisal Vidali hen miharu adi rajyega tibi nawara kudinne kuda kudinge gotuga COVID positive datta names kudinge halus irad kurabiya rangale then thalassaemia kudinge terega COVID adi nen alon menge rajyega alhamdulillah then ehen nama ves alon men samalukan denje he by thalassaemia community yaki nazuk nuata vulnerable group ek gotuga identify ve fatibe group e vima alon me miha boda mikudinna samal kam dem mi jeheni ade hasa ko sickle cell patient unna then shift news evsech ed kollam beenon tamia
as a patient gudalangati vara power precautions nagane astumi honnani hem kina ehen me tel community of us or sickle community of us warang advice kurave deve deepa hunna instructions follow kura misalaka transfusion na dam veema appointment heddu durala ulegen haddagen dairu mask kalage huri have safety precautions nagan dashe like Dr. Michael, I would like to say a lot of our patients, our community is very, very concerned about our health and our well-being. So we are taking a lot of precautions to stay home and make sure we don't go out. And we are also doing our best to ensure that we have our medicines available at hand, so we don't have to go out every 2 weeks to go and get the medications. So in my case, my family helps me support by buying groceries or whatever it is for home. So I don't go out. I have not been out of the house since March 14th. So likewise, I feel like all our patients are very well aware of the situation and what it may do to their health in regard to, being exposed to the infection. So we are taking all the necessary precautions, and I advise my fellow warriors to be very cautious and very safe when you're going out or for blood transfusions. Also, we have a question that has come up among a lot of patients, a worry that they seem to think, can COVID be transmitted through blood transfusion? So this has caused a lot of anxiety among those who are transfusing. So I would also like you to help us highlight on it as well.
Okay, may I answer that?
Yes.
Jihan, may I answer this concern?
Yes, Dr.
Okay.
Michael, it is actually a question forwarded to you by,
Basically, there is no evidence so far that the coronavirus can be transmitted by blood. This is not an 100%, if you like, experience, but it's highly unlikely. These are respiratory viruses that are transmitted, as you know, from the respiratory tract. So far, I don't think that there has been a single report anywhere in the globe that blood transfusion has given this infection. This, of course, does not mean that we shouldn't be cautious. And I was very happy to hear Dr. Amar say that even blood donors are triaged, their history is taken, where have they been, do they have any fever, do they have any symptoms? This is important. This is both for the for the safety of the donor as well as the recipient. So we continue these precautions, but blood transmission has never been proven.
Okay, thank you. Okay, adjusting to a new normal by thalassemia patients, I think this is something we are finding it hard, even for us normal people, but for patients and their families, this will be a crucial thing. Adjusting to new normal, what would that be?
Sorry, what do you mean by adjusting to normal life? All right.
Adjusting to the new normal.
All right. Even for the general population, we are afraid that as the lockdown procedures are being relaxed, we may have a second rise, if you like, in the number of COVID cases. So we continue to be cautious. We continue to have social distancing. We continue to wash our hands frequently and with antisepsis. However, one question that emerges is from adult thalassemics about their work. Should I return to work? And what about school children? Should they go back to school? Now, this is generally a matter for the national authorities, and there is no generalization. However, as Thalassemia International Federation, we still advise caution. We believe that thalassemia patients should go back to work, for example, if their employment is in a situation where they don't have to deal with a lot of people, a large number of people. obviously a large number of people would increase their risk. And definitely in such an environment, if they have to enter such an environment, they must wear a mask as well as all the other precautions. So we continue precautions. Patients with sickle cell disease, I would advise to be even extra extra cautious, and stay at home even after the lockdown measures are relaxed. School children, that's a very hot subject. It's very difficult. This does not concern just children with sickle cell disease or with thalassemia. I think all children need to, sending all children to school needs to be very carefully considered by health authorities, by ministries of education, as well as ministries of health, to ensure that if they go back to school, if distant learning cannot be applied, then what precautionary measures should be taken? This is still an open subject, and I know that health authorities and educational authorities in many countries are still debating.
Yes.
Dr. Faisal, Dr. Umar, it's a vidal one. Alone minge situation kudakon adi tafat and to confined area gami ulenje heni ehemvimes kudakon tafat mung ekashigame.
Bargain cousins kuwas wire meeting and the Sina University vaccine Santa Cabeza, a may has influenza vaccine ki what I'm check come kujakas ark for jang. Nema kihas and Rakaterito vaccine jahan da. Nema Omdanwani asuga me COVID couldn't known as Girukudimi as a Kurukudimi, Yavaga Midan Saga, Rakamanaki, but I can vaccine in the Katerko de Baditacomia, so meaning of cover. Vaccine last Kurumaki, Ekirangoteno, Asago me, influenza vaccine, Jahangotia, Mama Jahan, Dumi, Buturi. And then I get vaccine Jahan, Durua, Eruga, a Kader comes to a bit by pure time, Saga, me, Amotic, Texi, and Nunego. Tanya Budangali me open me hinga Nunia Sakale Gadio, Targo mask Elma Adi Atusa Targam Nigaram Himo, and go say me only me vaccine appointment of Suman and Vima etam Turnu Janet and my target Ben Duruga and Waki Gadia Ghost me vaccine Mijahan and Vima Alanawani vaccine Jehmotiam Jehom Miga of Sugara Buddhi or Muhim.
Dr. Faisal ke my point aadagada kollana me thalassemia kudinna me influenza vaccine jahan benwa kam gawana hama thalassemia center MBS sum sama vaccine jehen intisam ham che fannane hevem ama thalassemia center doctor dakkan anna iruga noni leyalan anna iruga vias ama ituru visit එක ගොතු ගනුහද ඩොක්ටර් දක්කන් අන්න ඉරුක අම වැක්සින් නගෑගෙන් ඇස් අම ජෙහෙන ඉන්තිසාම් හම ජේ ෆන්ඩන හැම ඉන්තිසාම් ස්ටේසිම patient උන්න හොලොයි ෆරිවාහකම ෆා කොල්ලන්.
Yeah, coming to the blood donation, I mean, campaign, I think that is a very good thing, and we congratulate you on that. And one thing that comes to our mind, and as the patient organization, something that concerns us is the island community, because they are remote, their blood supplies, I mean, the donor population will be much lower than in the capital island, Male. And we have half of our patients in the outer islands. So what are the plans if in case of a lockdown in the islands, what are the plans? Wara gina faharang alon menang arna suwaleng hama meharu kuda abadiyen onna rashegga misalaka A positive, not a B positive, A B positive, tankore udaguane O positive agure hodan hema kinetto mikahala kudi communities ka kudinna le hodumuga kantata adi ekala base gendiyumuga kantata hamaji hifoti hen engilun ei muhimu kame kannege kudinna. Dr. Umar etche vidalge.
Me dehas satarwan harum fashike mi behuga kantamiyoti STO medwerko ekujjakuti dole rashun libegota hamji faden alon mena STO en hama warabod yagin kan defa feboy mi situation gavesama medunu kendi base fiharta kum base tibene intizam hamji gen dane kam heta den leelumuge kantaka bala eroga leelumuge tidene vi hem bay faharuga bay rashun bay kala group talibumuge datan e bawle den almenna hama hami mi situation ka fahum sama e bahuri algan men komme mi gavadum malia leyalan anna bi negative kujje atol terego direlo munda kujje den lockdown aguli ka malian adu wennes munga sabun algan me malen le nagafa e kujja benu wale rasha fono ade fawane ehme e gotan e bahuri intizam ta hama jehifa e rasha kun le di men nen halatuga le malen vies adi carry rashakun nagaf vies fonunge intizamta armen hama national emergency operation center guligen eba kuriya genda ingeta hemvema armen hama maseka kurana huriha kudinnaves kujjakan libenje he hidme libumuga evs dache neti farwa kankan kuriya gende fadi kotakan huriha kan am intizam kuruman algon ben abadis bitan maseka kurum
shukriya shifu එච්චබ්බුණල් දෙනතක patient එක්ගේ perspective on what in patient's perspective on coping with COVID and the situation. I think including their responsibilities, I think that is something that we all need to know because we need to support our patients, their families throughout this.
Yes, thank you. There are a few points that I have noted that could help us be more cautious during this pandemic. None of us have been through such a public health emergency in our lifetime. So I would like all patients to avoid public places, and especially those who are working. I feel like the employers, I would like to request the employers to consider their high-risk patients who are working with them to actually make arrangements for them to stay home and work if it is possible. And the other thing is for families who live with our warriors, I would like them to maintain social distancing when the family members go out and come back into the house, and also avoid exposure to the risk to the pandemic so your loved one is safe. There's also those who are seeking medical attention. A lot of our warriors have other complications that they are dealing with apart from transfusion. So most of the warriors who have these complications to be extra cautious. We do understand that those with diabetes or heart difficulties they are more prone to the COVID-19. So we would like the care providers to help them understand what their responsibility is during this time. For example, what they need to do in order to be, more safe during the time. And staying home is stressful sometimes, but we try to look for information and always go on the news to see what's happening, and it can become stressful and it can cause a lot of anxiety among us. So I would really like to advise my fellow warriors to seek the verified information and also seek the correct information from authorities rather than depend on every single bit of news that gets spread through social media. Also I have come to notice that a lot of our patients who are not compliant with the chelation have a lot of excuses, such as I'm very busy going to work and I have school during this time, so I do not have time to chelate as long hours. So now, since we're staying home, I think it is a very good time for us to start this chelation process again and make it a habit, so that by the end of the lockdown, we are in a better health than we started. So I also would like to thank all the clinicians and nurses who are doing their best to ensure that we have our treatments without, being exposed to the risk. And there are other things to, like, reach out if you have questions. We are here to help you. So many things comes to my mind, but I think if there's any further questions, I would go into that just then.
Thank you, Shifu. Yeah, thank you. I think
Yeah.
you have highlighted quite a number of key points, and throughout your answer, my mind went into the study that we made in Maldivian Thalassaemia Society we conducted in 2014, which is still relevant. And one thing that came up as a main theme was the need for psychosocial support to all our patients. And that is one of the factors that impacts their compliance to treatment. And we always hear that our patients are low in compliance, and this is why even when we go to a meeting, it will be highlighted that the compliance is low. So we need to focus on why the compliance is low. For example, giving them the proper support. I think that is something that we are here to do. And as well-wishers, volunteers, the frontline workers, I think we need to make a shift from a whole person approach to deal with this situation. And also this is, I think, a prime time for us to start thinking about the psychosocial aspects of our patient well-being. And shifuga wahakaga faga ekolli patientum shifu kudakon kiyala denviyanu divehin e shifuga wahaka kolo.
Meru deme dekwa terega public tantana nudashe mihungina tantana nudashe nusaka pihareka vias nugos vihaves poda kega hurege miharu online platform ta develop wa eru piha echa gannum vias pera nugos manage kurevenya e halat manage kureve to palashe then families members bera nukume ge banna erues hama safety precautions nagam sakang addovun eti bakurum kujaya deal thalassaemia hunota me high risk patient a deal kuren jehe komme halatega safety precautions hunnawane rangalan addo fa hunnawane bera gos asa hama me timana safe eten edes timana carry koffane kama business family members ehem me ebbes kahala symptom en hurikama vanya avaha doctor gula ekan arrange kuru then le alan diumuge kure misalaka 20 days on le alan jehenya kuriyala appointment haddashe dam vima noni miha le alan jehekan amile varubaliwa peshima en none try kuramani ke er paharega gina duhu madukuran jedan adi le naalaves ei appointment usulan dupurakama vanya time slot take mihunani limit efem e limita ane kuriyala visnagen slot hodammaane le alandiumga kuri noni doctor dekkan diumga kuri base naganama base tampala gina duha base neke to balasha misalkam mask chi hodam beenumanya e nukunna iru mask achievers mihar STO pharmacies registered patient ka vejja eba libe for type for diama ehema mi gannan libe ehem migota mask wes atuga abadwes husnuwana gota stock hunnawara manage kuracche then ebbes kamaka stress vanna gega hunnen jehenya abadwes suwalen otas health abehe gotun ebbes kamaka fikuru bodu vanna wes me Thalassaemia Society ke members unna adi doctors unves me tibi hama huriha emmenavves information for kodden share the public level ga patient nona situru swatake hurinama adanmenna e forward kolla fiya e respond kuraname en huriha emmenavves sama me passeha dos kolano me ki ekam koes ane handan bahatam wane hama service provide kodden care providers etibeni emihun gamilla self-based risk Allah for him emihun expose nukureveni as patients I don't remember Amelia balagen precaution nagagen safe ko tibiya.
Thank you, Shifu. Alunde even e kalalon mes me yagane ka March mahum feshigen hama me kamoga me oleni hama vara active kon hema vara gina kudinna beleni veringe hama shakwaataka hinnutanavasuma babar maulumat saaf korvasa malon menna gula Maldivian Thalassaemia Society ya then meegateren alon menna faaga korevan me alon menge vara gina ane bodati adult population in eba ule gina kudin masekatadde da iruga ekamuga anen utana waskan alon me mebunani gega tibeshe ekam gega tibegen ekudinna bay kudinna kanne income earn koreveka nota hama ebba kudin front line ges masekken eba kore ema precautions nagagen masekke kurun waram muhimmo den mige iturun hama ane kamen otiyamun alon menna ves hissa kolla devashe vi varako masekke kurana hama alon men mitibi tibe fulun kudin adi ane ailataka malumat hissa koddenu mami kankamuga ehitere buma tayyara ehma huriha menna ves hama shifu ebani hen Dr. Umar Dr. Faisal huriha be fulun vidalu hen pase duas kolenno ehma emmen ekkom mi kamuga kuriyaddium waram muhimmo Dr. Michael, I was just translating what Shifu and Dr. Umar, Dr. Faisal was saying. And is there anything that you would like to add in our context or in the global context as well?
No, I guess one issue that the international community is interested in, is curious about in many ways concerning the Maldivian society, is how you deal with the islands and the population that lives on isolated islands. This is a fantastic challenge to any country, to anybody. And I was interested to listen to Dr. Omar dealing with this subject concerning blood donation. And I was really wondering, how does the Central Blood Bank in Male actually transport units of blood to the islands when needed? In some of the islands, are there blood banks which can actually make concentrated red cells, or is whole blood or does whole blood have to be given because of lack of facilities? These are all sort of questions that come to our mind, particularly in the Maldives.
Okay, Dr. Michael, at present we have in two other centers we have a centrifuge facility, so where they can prepare concentrated red cells immediately. But in other islands, it's still practicing the standard keeping it overnight and removing plasma. And at present, we do not practice whole blood transfusion in thalassemia patient in our country. We are giving packed red cells throughout the country. And in this situation, in this COVID pandemic, in case if an island get locked down and there is need for blood to be transported from outside of that island. We have arrangements with the National Emergency Operations Center to facilitate the transport of blood either from Male or from the any nearby center, nearby health facility where blood can be collected and transported. So we have even carried out one such transportation since the beginning, because there's one patient living in an island with B negative blood, and they could not get any donor from the island, so we bled the donor from Male, and we have transported the blood and provided them on time for the transfusion.
Excellent. I'm glad that you are meeting the challenges. This is very important. I think the other comment I would like to make is on Shivni's emphasis on psychosocial support. This is extremely important under any circumstances, but under the circumstances of lockdown, this becomes very important. And I wonder whether webinars like this, virtual meetings, talking to patients in their own homes through these media might be something that associations might adopt on a more regular basis, because sometimes patient fears, patient worries and concerns may get out of hand. We may get depressions and other issues. So this is just an idea of more regular meetings, virtual meetings.
Thank you, Dr. Michael. I have two questions for Dr. Faisal that came up. Are the hospitals safe for patients to go? Because that's an anxiety factor as well, but is it safe for patients to go? Then the second question is, what if a patient becomes COVID positive? What are the measures in place at the moment? Maybe both of you or Dr. Faisal.
Yeah, I want to make hospital komme anna jeh jahatek gavijja anna jehen imsa farwayen hodam ves nuni testing hadam ves komme anna jeh jahatek gavijja ei hospital anna jeh kamaki ema ekutan anna jeh paradaka hospital ge wani rakkadema fiyotin alafa e anna iruga wadiveni hum beduma fawga adi itura suwade kuleben baldi foto nunto nuni addo mamka administration benukro ema kansa ke fiyorti kan rifa hunnan then doctor dakkan anneka miya misaka hume nuni roga ekaichen hurijiyamo awme mihar innane wak area haasa kurefa area ga bali miha bawafa sample covid test kofa negative vejjiya ekane hospital teriya deven hospital teriya kan nudigendana ana positive mi positive vejjiyamu gendana ekam haas kurefa wardaka nuni jaramant hospital ge ekam haas kurefa floor ya nuniyamu mi awa min hunna isolation facility eka e positive vejjiyamu negative vejjiya ekane hospital tereng awme kurakudinga ward base nuni me bali mi hun amuko mi genda ward ta genda hema every government dannawani hospital gawani warang me rakkadama fiyorta gen elifay then balimiha badan darges doctor mes adi narhum mes dani hama the personal protective equipment mask ta kanuni ek manje fiyorta alage ema hospital danji halategga kudinna rakka tirwan then positive vejjiyam me den evden e positive vejjiya ekama haasa kurefa ward ka nuniya facility ka miha gendan miha awme kurukudin avati tin hatar facility gasuga me Holiday Island होटल गया एक तो खुड़बंड हो गया फारकोल हो गया आदि एम्बूदु विलेज गट्स एम हातर फैसिलिटी है कि बत्ती में खुड़ खुद पॉजिटिव व्यक्ति भी एम पॉजिटिव वेजिया आदि खुड़ खुद इन्होंने संदर्भ बढ़ते मियम वैस के अंदर ने मिकाल आइसोलेशन फैसिलिटी है का माँ बड़ा बाली उन्होंने आइसो फरवा देंगे जिया ट्रीट ऑफ हॉस्पिटल्स कवर कर दिया मिको तो अनेफा वक्त हाथ से करना गंदा या वो मिग मैगन मिस्टर की ऐसा का અને ಒಮ್ಮೆ ಹೋದಂಗೆ ಫರವಾಯ್ ಲಸ್ನ ಕುರಚ್ಚೆ ස්කොග්ගම් විද්‍යාම ඒගේ නොක්ක මා බොඩෝ දාන මේ අසු කොවිඩ් බෙෆබාදක මේ අපිටක මියන්න නම්බරතක අමිකන්තක බලා වරගෙන පරා එක බිවරකම ගෙතේ ඔරෙන්ජ් මෙම බිවරකම තෙරේක කොම්හෙන් බේනුම පරවායේ
Thank you, Dr. Faisal. Then, ane alon menge wagutwe samawamun annati we fahu suwalu inge tomi. How are we going to cope with not getting enough blood for our patients? Well, rangal suwala. That's how, because alon menge donor pool for the kuda then lockdown nuata komme contact kabumuga possibility waran high ginami hunge. That's how are we going to cope with not getting enough blood for our patient? That is the lifeline of our patients. So is there any plan or what do you have in mind? Dr. Umar, maybe.
Me COVID navar me situation me halatan awma goligen ve sama aron kone sar aron faha kori gota le dibum ga dati taken nawes aron men me hama me public concern ke gotuka me kam faha ko mun rayituna hisab me malumat for ko dinuma hisab fashiken armen hama fodewer ka rangala le dibum libem e ba ade me wagutu ingata din me halat itura digu demigen gosikam gawana mati dene vi hama oi fursatin le dibumuge datikan den hama mi arme mi le nagani hama naganje international mi federation takon deva fawa guideline ay kotang covid shako koreve besa alamaten horito covid jehun mi ka badal vito mi huri ha malumat saf kuron pahoga lega rakkatir kan kashwar kuruma kuren che huri ha kamaka ekolle nagam dati idene vihen adi miavoren product community spread ka gosikam gawana contact tung genavom ge fursato e boyen hem kam gawana ma dedi punga tatken awmu ke kashikam ba kame ehem vej kam gawana ma margon men ba visnan me around men vehra jofedi for gotun algon men e boy war pod advantage me around men ratta working hormo ge sabun ekira hama safe ratta ke ve samalgon men hure dane ifad halate galgon men hama visnun e bahuri malen le dibun datitake kurmete wakam gawanama carry hen ra safe kon huri hen rashun de nagagen genisken namaves alumenge patient na benuwa mibara de hodumuga maseke alume hama eba refe bahuri ingeta mi dadi fahum hama rodama sveshumuge kurin ves algon me rozmo feshum muge etus kurin algon me wane ma fushin ves ma futan algon me team e gos ma fushin ves le by donor ungele na gen sama hafawane hemima if the program take ves re fahuri le for le algon hama para boda hama gabul kora kame le ki me kudinge dirulum ge muhimo maada muhimo pa hemim e anule komegotes mi tasimi patient una ka diri not be wen have sabo le libumuga hama tattake kurmati nuwa wane gotaka hama kantata reum algon men hama puri hafarataka guligam maseke kurawum midani.
Thank you. And Gadiva Samavi, thank you so much. And I think we've come to the end of this program. And yeah, Shifu, please.
There's a question for us, I think for the doctors. If a patient gets positive, should there be continuing chelation?
Yeah, very important one. One of the doctors, please.
Dr. Michael, do you have any opinion on that?
If the patient has fever, it is recommended that they stop chelation temporarily until the cause of the fever is finally diagnosed. If it's COVID, then chelation should be recommenced. Now, there is a theory that high iron in the blood will facilitate the replication of the virus. And this has the potential of making the COVID infection even worse. So chelation should continue if COVID is a proven cause of infection. For very severe cases that need to be hospitalized. It is recommended that intravenous desferrioxamine should be given. But again, this is something that has to be discussed and according to each individual patient's needs. In general, the answer is in COVID positive cases, continue iron chelation.
Thank you. Thank you very much. And thank you so much for the valuable information you have given Dr. Michael, Dr. Faisal, Dr. Umar, and Shifu. And I would like to thank Thalassaemia International Federation, Maldivian Blood Services, and also VTV for live streaming our event, and wishing all of you happy International Thalassaemia Day, and may you have a blessed year ahead. Thank you so much.
Goodbye for us, from us too.
Bye.
Thank you.
Bye.
Bye-bye.
Thank you.
Thank you.
Thank you. Bye-bye.